Hi everyone, I am the nurse Tutor agent, and today we will be going over immobility complications. So, if you are struggling with understanding what complications can arise from being immobile, then this video is for you. So, these are just the target areas that I will be talking about. So, let's get started. All right, so the first one we're going to talk about is cardiovascular disease. So, how does a patient being immobile put them at risk for cardiovascular diseases? So, the first one we're going to talk about is venous thrombosis, which is a blood clot. So, this happens when basically there is a slowing of your blood flow and the blood then starts to clot together. So, what I think of it as with traffic. So, if we're driving right on the interstate and there is no traffic, then we're flowing, right? But let's say an accident happens, right? Blood starts to slow down. You have to slow down, right? During traffic, you start to slow down. So that puts us at risk for what? Accidents. And accidents as it relates to your blood is puts you at blood risk for blood clots. So you just want to think about it. When your blood is flowing how it should flow, then guess what? We're not going to be at risk for any clots or anything. But anytime your blood starts to slow down, due to the patient being in the bed all the time, so your blood vessels start to weaken and they can't push the blood throughout the body like they should, or even when the blood starts to pool in the legs due to immobility, then that puts the patient at a risk for blood clots. So one of the biggest things that you will see your patient in the physician order when you're in the hospital is they will order SCDs, or you can call them leg pumps, and they put those leg pumps on their legs, and what that does is that keeps the blood circulating even while the patient is immobile. Also, what they can do is put the patients on a blood thinner, and that prevents the blood from clotting together. All right, another one what you can see is orthostatic hypotension. So that's what is orthostatic? That's when we have a drop in our blood pressure when the patient stands. So that happens as well as a result of just the blood pooling in that area and not being able to circulate back to the heart like it needs to. All right, now let's talk about our respiratory system. So, immobility that leads to atelectasis. So, atelectasis is basically a collapsed lung. So, in order to prevent atelectasis, we want our patients to be using an ascending spirometer. So, we'll go over this in lab, but with the ascending spirometer, it basically expands, it helps with lung expansion. But we will go over how to use the ascending spirometer in class, and it is important that you teach your patient how to use a ascending spirometer. Another one your patient will be at risk for is pneumonia. So pneumonia basically happens due to a buildup of mucus. Now, one I want to talk about specific is hydrostatic pneumonia, and that is caused from patients who are in the bed over a prolonged time. They start to be at risk for pneumonia. So you want to make sure to prevent this in these patients that are immobile, that you want to have your patients take deep breaths, and you want to make sure that your patient is coughing. Also, what you can do is increase your fluids as well to thicken out those mucus secretions so the patient can actually bring it up. But we want to remember that hydrostatic pneumonia, that's that type of pneumonia due to that mucus buildup because your patient is immobile. Your patients also can have a weak cough, right, which leaves it harder to clear your secretions. So you just want to make sure that you are teaching your patient how to use your ascending spirometer, that you are increasing fluids in your patients who are immobile, and you're teaching your patient how to cough and deep breathe and cough, okay? And that deep breathing that helps promote a lung re-expansion. Moving on now to our musculoskeletal system. So, patients are at risk for atrophy. So, the patient could have muscle wasting and muscle weakness. And why? Because they're not using it. So, if you lose it, if you don't use it, you lose it. So, patients could also be at risk for osteoporosis, which is bone loss. Patients could also be at risk for contractures due to, which is joint stiffness. So, you will see a lot of times with patients that their arm will literally be like stuck in a position where it's like balled up. So sometimes what we'll do is we'll give them like a little towel or something like to place in their hand, just so their fingers and stuff won't get contracted. But when the patients get contracted, it doesn't matter how much you try to move it out, like it just will not come out, and it really hurts. So we want to make sure that even while our patient is in bed, that we're performing range of motions activity with them, like we, having them go like this. And let's say even if it's passive, meaning we have to do it for them, but that we're doing some exercises. So you don't have to be physical therapy in order to do some little exercises with your patient to to prevent their joints and stuff from stiffening up on them, because if you don't use it, you will lose it. So also it can also, the patient can also lead to weakness and paralysis of the ankle muscles, which is considered foot drop. So you do want to read in your book how you can prevent foot drop in a patient. Okay. All right, so the next system we're going to talk about is our gastrointestinal system. So with a gastrointestinal, you will see that the patients will have constipation, and being that that patient is just in the bed, it leads to slow digestion. So how do we combat constipation? So we want to increase our fiber. We want to eat fruits and vegetables, and then we want to increase our fluids. And then if the physician wants to order a stool softener, he can. Now you're just like, Dr. Bonnet, well, if all these things come from being immovable, just make the patient mobile. Well, it's not that simple. So let's say if a patient is paralyzed, what can we do? We can move. We can turn them every 2 hours, but what if a patient doesn't have any legs, like they're immobile, so it's just not that quick fix to like, well, get them mobile. Now it is a quick fix if we have someone who is an able body, meaning that they can move but they just don't move, then proper education can help them out. But in some instances, it's literally nothing we can really do. All right, also these patients could have decreased appetite, which can lead to poor nutrition. Moving on to the urinary system. So these patients right here will be at increased risk for urinary tract infection, because the urine starts to pool in the bladder. And then also this patient could be at risk for urinary retention. So it's harder to fully empty their bladder. And this patient will also be at increased risk for kidney stones. So let's go back to talking about the musculoskeletal part real quick. So when calcium leaves the bone, due to the lack of weight bearing, it enters into your blood. So the more calcium in your blood, the more calcium is filtered out in your urine. So when urine sits in the bladder, which is stasis, that makes crystals form more easily. So this is why the patient would be at risk for kidney stones. So with UTIs, you just want to make sure that you're trying to put this patient on a toileting schedule. If they do develop a UTI, then we would want to give antibiotics. And then we want to make sure that if they do have a kidney stones, that we are straining their urine. All right, so let's talk about your integumentary system. So the skin. So patients are going to be at a big risk for pressure ulcers. So just think about it. If you're not moving and you're just sitting on those bony prominences, so our bony prominences, such as our sacrum, such as our elbows, such as like the back of our heels, you can get pressure ulcers anywhere. But we want to think about those patients who are immobile or who are just laying on their butt all day long, right? Just like how this picture shows, that right up in that sacral area, skin is going to start to break down. So how do we combat this? So we want to make sure that if our patient is able to turn on their own, we want to tell them that they should be switching sides every 2 hours. But if your patient cannot turn on themselves by themselves, then we want to turn this patient every 2 hours. We want to make sure that we're keeping this patient's skin dry as well. That's really important. And that if we have to use like barrier cream, and barrier cream is just another layer of protection to prevent the patient from their skin breaking down. But it is so important that you are turning your patient every 2 hours. So when I mean turning your patient, I mean offload the pressure on their butt. So what we would do is we would turn the patient and we could put a wedge under them, and what that does is it relieves the pressure from off the sacrum area. Also you can have pressure also like on the bottom of your heels. So we have little special booties that you can wear as well that will get your heel off the bottom of like like sinking on like on the mattress, that it actually floats your heels. Or you can literally just put a pillow um, under their knees, and that'll float their heels. So you just want to make sure that you are turning your patient every 2 hours. And if your patient is dealing with any urinary or incontinence, meaning they can't control their bowel or bladder, then we want to make sure that we're keeping their skin dry. So now let's talk about our psychosocial outlook. So just think about it. If you were immobile, like you were stuck in a bed and you wouldn't be able to do for yourself, how would you feel? So patients deal with depression and sadness, anxiety, restlessness. They have a decreased self-esteem and motivation and feelings of isolation, because that patient is unable, to participate in some activities, especially if the activities require you to, like leave the room or something like that. So you want to just make sure that we keep that in mind when we're caring for patients who are like bedridden and like bedbound.